Welcome to Vital Signs in the Trauma Bay. Today we are going to be discussing vital signs, what they are, why they're important, and how to obtain them. Initial vital signs in the Trauma Bay are critical. They determine the patient's plan of care, including what medications they get and the dosages of those medications. Vital signs that we're going to be discussing are heart rate, respiratory rate, temperature, blood pressure, and pulse oximetry. In the Trauma Bay, the initial blood pressure must be obtained manually, so we're going to learn how to do that. Getting it right is not difficult, but it does take a little bit of practice. One thing I want you to remember is that you need to always talk to your patient throughout these procedures. Inform them what you're doing, why you're doing it, and reassure them throughout the procedure. The correct placement of the oral thermometer is under the tongue against the frenulum. The best way to instruct your patient on this is way in the back by your molars. You're then going to have them close their lips around the thermometer, wait for the thermometer to beep, and you have a temperature. Super simple. Cardiac leads are placed on the patient's chest. The white one goes on the right, second intercostal space, mid-clavicular line. The black one goes on the left, second intercostal space, mid-clavicular line, and the red one goes on the left mid-axillary line at about the seventh intercostal space. The easiest way to remember which one goes where is white on the right and smoke over fire. With the pulse oximeter, if you don't know what one looks like, there is a picture of one in the lower right-hand corner. It goes over the patient's fingertip. This will measure the oxygen saturation in the hemoglobin in their blood. When they're on the monitor, they should have a blue line that looks like the one in the left-hand picture. That is called a pleth wave. The normal signal is the top line on the middle picture. If your pleth wave looks like any of the other lines, you need to make some adjustments. You're not getting a good reading. That could be because they have a blood pressure cuff on the same arm, their hands are cold, or they have poor circulation. Maybe they're wearing dark fingernail polish. They may have a band-aid or something like that on that finger that you didn't notice before. Or you may just not have the oximeter placed properly over the fingertip, and you can adjust that very simply. The initial blood pressure is always manual. Before you put the blood pressure cuff on the patient, you need to ask them if it's okay to take their blood pressure in that arm. If a patient has had a mastectomy on that side, you cannot use that arm for a blood pressure. If the patient is a dialysis patient and they have a fistula in that arm, you cannot take a blood pressure on that arm. Then you're going to make sure that you have the correct cuff size. When you lay the cuff against the patient's arm and start to wrap it around, there are arrows that will meet up, and it's very easy with those arrows to determine whether or not you have the right size cuff. Do not place the blood pressure cuff directly over an IV site, and make sure that it's on the patient's upper arm with the bottom of the cuff approximately 1 inch above the elbow. Once you have the cuff in place, you're going to feel for a brachial pulse. That's on the inside of the elbow. Place your stethoscope at that site, and then you're going to make sure that your valve is closed on your blood pressure cuff, and that's the little spinny thing by the bulb that you use to pump it up. You are going to pump the cuff up, watching the manometer. You're going to pump it up to about 200. Then you're going to open your valve very, very slowly, and you're going to listen. And as you listen, when you first hear their pulse, the number that's on the manometer at that point is your systolic pressure, and when the pulse is no longer heard, that's your diastolic pressure. These are some no-nos for vital signs. I'll let you look those over, see if you can figure out what's wrong in each picture. We'll discuss them on Thursday in class. Remember that vital signs dictate patient care, and the more accurate they are, the more useful they are. Explain procedures to patients before you start if it's possible, and reassure the patient throughout. These are your content questions. Make sure that you bring your answers to class on Thursday. Also bring in your muddiest point. What was the most confusing aspect of vital signs for you? Bring those with you to class on Thursday, as well as your stethoscope, because we are going to be practicing vital signs on each other. See you in class.